It happens every morning like clockwork. You stand at the kitchen counter, open your little pill organizer, and pour a colorful handful of supplements into your palm. There's the golden capsule for your heart, the small pearl for your skin, maybe a multivitamin for good measure. You swallow them down with a glass of water, feeling a sense of pride. You are taking care of yourself. You are investing in your longevity. But what if I told you that inside your body, two of those healthy, natural pills are teaming up to create a dangerous chemical reaction? What if instead of protecting your heart, they are accidentally stripping away your body's ability to heal itself? Millions of women over 60 are unknowingly creating a super thinning effect in their blood by combining two very specific, very popular supplements. It isn't a prescription drug error, it is a nutritional blind spot. And the terrifying part is that the symptoms, the mysterious bruises on your arms, the nosebleed that won't stop, often get dismissed as just getting older. Today, I am going to show you exactly which two supplements to watch out for, why they are a risky duo, and how you can fix your regimen to stay safe without giving up the benefits. I'm Dr. Emily Hart, and my goal is to help you become the expert on your own body. We are living longer, stronger lives, but that means we have to be smarter about what we put into our systems. Before we open the medicine cabinet, I have a quick question for our community. Tell me in the comments, how many different supplements do you take every morning? Is it just one or two, or is it a handful? There is no judgment here, just curiosity. I love seeing how proactive you all are. And if you want to make sure your routine is actually helping and not hurting, please click that subscribe button so we can navigate this together. Let's start by looking at that morning handful. We live in an era where we are told there is a pill for everything. Dry skin? Take this. Foggy memory? Take that. Stiff joints? Add this one. And generally, this is wonderful. Supplements can be powerful tools, but we tend to think of them as food. We think, well, it's natural, so it can't hurt. The reality is that concentrated supplements act like drugs in the body. They trigger biological pathways. And just like you wouldn't mix certain prescription medications without asking a doctor, you have to be careful about mixing concentrated nutrients. The danger I am talking about today isn't toxic poisoning. It is about interference with a vital survival mechanism. There is a delicate system in your blood that keeps you alive every single day, and you might be accidentally turning it off. But to understand why this matters so much, we have to visualize what is happening inside your veins when you get a simple paper cut. I want you to imagine your blood vessels are like the plumbing in your house. Generally, you want the water to flow freely. That is good circulation. But unlike your house plumbing, your blood vessels are made of living tissue that can get nicked or damaged. When that happens, say you bump your knee or cut your finger, your body has an emergency repair crew ready to jump into action. This crew is called clotting. Think of your blood platelets as tiny, sticky sandbags or microscopic bricks. Normally, they float around smoothly, but the moment there is a leak, they get a signal to become incredibly sticky. They rush to the site of the injury and clump together to form a natural band-aid, or a clot. This stops the bleeding and allows the tissue underneath to heal. It is a brilliant, life-saving system. However, as we enter our 60s, this system becomes a little more precarious. Our blood vessels aren't quite as flexible as they used to be. Our skin is thinner, meaning we bruise more easily. We want our blood to flow well to prevent strokes, but we need it to clot quickly if we get hurt. It is a tightrope walk, and this is exactly where our slippery duo comes in. We're taking two supplements that essentially grease the tightrope, making it impossible for those sticky sandbags to do their job. And the identity of these two supplements might shock you, because they are likely the ones your doctor told you were good for you. So, who are the culprits? Culprit number one is omega-3 fatty acids, commonly known as fish oil. We love omega-3s. We take them for brain health, to lower triglycerides, and to keep our joints lubricated. They are fantastic anti-inflammatories. Culprit number two is vitamin E. We take this for glowing skin, for immune support, and as a powerful antioxidant to fight aging. On their own, these supplements are heroes, but here's the secret mechanism they share. They are both mild anticoagulants. In plain English, they are natural blood thinners. Omega-3s work by making the platelets in your blood less sticky. They literally change the shape and chemistry of the platelet so it doesn't clump as easily. This is actually one reason they are heart healthy. They prevent dangerous clots from forming in your arteries. Vitamin E does something very similar. It inhibits the ability of platelets to aggregate or stick together. Now imagine you have a team of workers trying to build a wall, the clot, to stop a leak. Omega-3s come in and grease the bricks so they are slippery. Then vitamin E comes in and tells the workers to take a nap. Suddenly, you have a leak that simply won't plug. But the real danger isn't just taking them, it's the mathematics of risk that happens when you combine them, and that is exactly what we need to calculate next. You might be thinking, Dr. Emily, I've taken both of these for years and I'm fine. And that might be true, at low doses. But biology is all about thresholds. 1 plus 1 doesn't always equal 2. In the body, 1 plus 1 can sometimes equal 10. This is called the compounding effect. If you take a high-strength fish oil, say 2,000 milligrams because your joints hurt, and you pair it with a high-dose vitamin E capsule, say 400 or 1,000 IU, you are stacking two blood-thinning mechanisms on top of each other. You are pushing your blood's clotting time from normal to delayed. Here is the "wait, really?" moment, the fact that catches almost everyone off guard. I want you to go to your cupboard right now, or after this video, and look at your bottle of fish oil. Read the other ingredients list. Did you know that most manufacturers add vitamin E to fish oil capsules as a preservative to keep the oil from going rancid? This is the hidden trap. You are taking a vitamin E supplement because you want nice skin, but you are also taking a fish oil that already contains vitamin E. Plus, maybe your daily multivitamin has vitamin E. Suddenly, you aren't taking a safe amount, you are triple dosing on a blood thinner without even realizing it. You are flooding your system with anticoagulants. The result? It's not always dramatic at first. It starts with mystery bruises. You wake up and see a big purple mark on your thigh, and you think, I don't remember bumping into anything. That's because you barely touched the table, but your blood was too thin to stop the microscopic bleeding under the skin. Or perhaps you brush your teeth and notice pink in the sink every single day. Or you get a nosebleed when the weather changes, and it takes 20 minutes to stop instead of 2. These aren't just annoyances. These are red flags waving in your face. Your body is shouting, I can't form a clot. And while a bruise is manageable, what happens when the stakes are higher? That is the question we have to answer, because after age 60, the fall factor changes everything. I want to have a serious, compassionate sister-to-sister moment with you about gravity. When we were 30, if we tripped over a rug, we caught ourselves, dusted off, and kept going. Maybe we got a scraped knee. But after 60, a fall is different. Our reaction times are a split second slower. Our balance might be a little off. And critically, our tissues are more fragile. If you are walking around with super thin blood because of this supplement combo and you take a tumble, the consequences can be severe. A simple bump on the head that would normally result in a goose egg could turn into an internal bleed. A bruised hip could turn into a massive hematoma that complicates recovery. And let's talk about the dentist. This is the #1 place where this combo causes trouble. You go in for a deep cleaning or an implant. The dentist expects the bleeding to stop in a few minutes, but because you took your fish oil and vitamin E this morning, you are still oozing hours later. It is messy, it is scary, and it delays healing. It is not about fear-mongering, it is about risk management. We take these supplements to stay healthy and independent, but if they increase our risk of a serious bleeding event after a minor accident, they are threatening that very independence. So, what is the solution? Do we throw them all in the trash? Absolutely not. I want you to keep your heart healthy and your skin glowing. We just need to perform a safety audit on your routine. We need to be the smart chemists of our own kitchens. Here is your practical, step-by-step plan. Step 1. Check the labels. As I mentioned, look at your fish oil. Does it contain mixed tocopherols or vitamin E? If yes, count that toward your daily total. Step 2, look at your multivitamin. Most multis for women over 50 contain vitamin E. Check the amount. Step 3, do the math. The recommended daily allowance for vitamin E is actually quite low, about 15 milligrams or 22 IU. However, safe upper limits are higher, but if you are on a high-dose fish oil, you generally want to avoid taking a separate high-dose vitamin E supplement, like those 400 IU or 1000 IU soft gels, unless your doctor specifically prescribed it. If you eat plenty of almonds, sunflower seeds, and spinach, you are getting enough natural vitamin E. You likely don't need the megadose pill on top of the fish oil. You can usually safely drop the separate vitamin E pill, saving you money and saving your clotting factors. Step 4. The surgery stop. This is a non-negotiable rule. If you are scheduled for any surgery, even minor dental work or a colonoscopy, you must stop both omega-3s and vitamin E at least 7 to 10 days beforehand. It takes about a week for your platelets to regenerate and get their stickiness back. Write this down on your calendar. Stop supplements 1 week prior. Ultimately, this brings us to the most important role you play in your life, the CEO of your health. We often go to the doctor, and when they ask, "What medications are you taking?" we list our blood pressure pills or our thyroid meds. We rarely list our vitamins. We assume the doctor knows or that it doesn't matter. I want you to change that today. The next time you go to the doctor, I want you to use the brown bag method. Literally throw all your supplement bottles into a bag and take them with you. Put them on the table. Say to your doctor, "I am taking these for my general health. I know some of them can thin the blood. Given my age and my history, is this combination safe for me?" If you are already on a prescription blood thinner like warfarin, Eliquis, or even a daily baby aspirin, this conversation is life-saving. Combining prescription thinners with fish oil and vitamin E is a recipe for disaster. Your doctor might tell you to stop the supplements immediately. You have the power to make these decisions. You are not a passive passenger in your healthcare. You are the driver. By understanding the chemistry of what you swallow, you are taking control. Navigating the world of nutrition can feel overwhelming, but remember, your body is constantly trying to talk to you. If you see those bruises, listen to them. If you feel unsure, ask. We want to live long, vibrant lives, but we want to do it safely. Tweak your dosage, check your labels, and keep those platelets happy. Thank you so much for spending this time with me. If you found this safety audit helpful, please share this video with a friend who loves her vitamins. You might just save her from a scary experience. I'm Dr. Emily Hart, sending you health and happiness. I'll see you in the next video.